Greetings, students. This video will serve as an introduction to the Nursing 153 Gerontology and Community Nursing Clinical Rotation. This clinical rotation is 90 hours and includes orientation to the clinical requirements and various sites we will utilize, time spent in those various clinical sites, and a simulation day in the nursing lab. Clinical sites vary each semester, but usually include a combination of long-term care facilities and community clinics such as Emmanuel Lutheran Communities, Montana Veterans Home, Kalispell Rehab, DCI, and Greater Valley Health Center. Students going to long-term care sites will meet their clinical instructor at the designated time and place as listed on the schedule. Students at long-term care will have a post-clinical conference as directed by your clinical instructor. Your course faculty may visit you while you are at long-term care or may attend some post-clinical conferences. Students going to community clinic sites such as DCI and Greater Valley Health Center will go on their own. Just go to the front desk at the time listed on the clinical schedule and tell them who you are and why you are there. Unless you are told differently, for each clinical rotation you attend, wear your uniform, your name tag, and do not be late. Students at clinics can leave at the scheduled time and will not have a post-clinical conference. The focus of this clinical rotation is to apply the skills and knowledge you are learning in class and lab to patient care situations. Both at long-term care and community clinics, you will work to improve taking vital signs, performing a complete head-to-toe assessment, performing daily cares, assisting with patient mobility, administering medication, communicating with other healthcare personnel and patients, and giving patient reports. While students are at long-term care sites, you will be assigned to a patient, not a nurse. You will have time to read about your patient on the first day. You will perform all the care needed for that patient as you are able. At some point in the rotation, your clinical instructor may give you a different or additional patient to learn about and provide care. Students at community clinics may be assigned to a nurse or another healthcare provider. You'll follow them around and jump in as you can. Communicate to the staff what you can and can't do. Advocate for your own learning and offer to do tasks and skills that you've been checked off on. You must bring your skills booklet, stethoscope, and phone with the Davis Drug app on it to all your clinical rotations. You can perform any skill that you've been checked off on by an instructor in lab. At clinics, you must be observed by a nurse or another healthcare provider who is qualified to perform that skill. At long-term care, you can do patient assessments, vital signs, and basic care on your own if your clinical instructor allows this. You will give meds and perform any other skills with your instructor. You will be given your instructor's cell phone number, and you can text him or her when you need them. Keep in mind that other students are there as well, so your instructor may be temporarily busy. The skills that you can complete each week will increase as the semester progresses. So I'm going to share my screen and pull up the Eagle course shell. Please pay close attention to the clinical schedule posted in your Eagle Online course shell under Modules Clinical Schedule. Now we're going to review the course syllabus. This clinical course supplements the lecture class of Nursing 152. The course is graded and you must earn at least a 78% in the graded portion and a pass in the pass-fail portion. Some assignments will be completed at the clinical site and some will be completed as homework. I will discuss the assignments in more detail in just a minute. Like Nursing 152, assignments that are turned in late will be accepted for up to 1 week after the due date and will have a grade reduction of 10% for each late day. Assignments will not be accepted later than 7 days past the due date. The late policy does not apply to the simulation prep assignment. Attendance in this course is a requirement. A student unable to attend a clinical assignment must notify the clinical instructor and faculty before the scheduled time. Text your clinical instructor and you can email your faculty, which is me. Missed clinical days may result in the student being unable to meet course objectives and possible failure of the course. Please refer to the Nursing Student Handbook for specifics regarding clinical attendance. Please arrive to the clinical site early and prepared to start your day. Electronic devices are not permitted at clinical sites except to text or call your instructor and to use the Davis Drug app. So now I'm going to discuss the assignments. The assignments and their due dates are all listed on the assignment tab in the Eagle course shell. The daily clinical evaluation will be completed by the clinical instructor with input from the student each day. The expectation is that you demonstrate some growth throughout the semester and work to meet the class objectives. These forms will be returned to the faculty instructor by your clinical instructor. These forms will be used to help guide the final evaluation for this course. And these forms can be found under the course content in Eagle Online, and I'll show you that in a minute. Next, each student must complete at least 2 medication passes with your instructor at the clinical site. You must earn 80% on each medication pass evaluation. The medication pass evaluation form can be found in this course under clinical paperwork. Lastly, the final clinical evaluation for gerontology and community health will be completed by both the student and the instructor. The self-evaluation section is to be completed by the student. The clinical instructor will complete the instructor portion with input from the faculty instructor. For this evaluation, students should earn 60 to 78 points in their first clinical rotation. There should be some components that students are still developing. There can't be any unsatisfactory scores in the bolded item. The gerontology and community health clinical final evaluation can be found over here under the module titled Clinical Paperwork. So here's the daily clinical evaluation. Here's the Med Pass evaluation. And here is the final clinical evaluation. And again, students in this course should obtain 60 to 78 points to pass the course. We do not expect you to be scoring much higher than that. The students will complete the self-evaluation portion and the instructor will complete the final evaluation. So now I'm going to talk about the assignments that need to be turned in. First, students will complete one journal when they attend the clinic or community site, right here. The purpose of writing this journal is for students to think about your decision-making processes, identify needed areas of improvement, and reflect on what you're learning. See the journal assignment rubric and instructions for further information. Journal assignment is worth 50 points and must be turned in electronically to under the assignment section. This is not due until the end of the course, but you are encouraged to turn it in as soon as you complete your time at the community clinic. We will have a simulation day in the nursing lab in mid-July. For this day, students will be practicing various skills in the lab, such as assessments and medication administration with instructor observation. The purpose of this is to ensure that students are continuing to perform their skills as they were taught and that faculty see a bit of progressive improvement. We will also perform a simulated learning experience in which students will provide care to a patient, which is a mannequin, while being observed by an instructor. Students must prepare for simulation by looking up necessary patient information. Each student must submit their prep work before the day of the sim to participate in the simulation. This is the student's passport to the simulation. Use the Nursing 153 simulation prep worksheet found in the assignment tab to help guide your prep work. Right here. If the simulation prep is not submitted on time, the student will not be allowed to participate and will get a 0 for that day's points. The late policy does not apply to this assignment. The simulation prep assignment is worth 50 points. After the simulation, students will complete an SBAR report on the patient cared for in the simulated clinical experience. Use the SBAR components and example found in the assignment to guide you, right here. Students will also complete a reflective journal answering the questions found in the assignment. The aim of this reflective journal assignment is to help students evaluate their clinical judgment and critical thinking skills. The assignment is worth 50 points. Please note, if you click on the individual assignments, you will find more information and a grading rubric. Most students find simulation stressful. Keep in mind that student performance in the simulation is not graded, but feedback will be provided. Students are graded on their prep work and post-simulation assignments. So now I'd like to review the clinical paperwork with you, found here under the Clinical Paperwork tab. The clinical packet provides all the information you will need for this course that I just went over. There is also a do's and don'ts list outlining what students can and cannot do in clinical rotations. Here is the daily clinical evaluation, the medication pass evaluation, and the final clinical evaluation. Please print a daily clinical evaluation for each shift and one medication pass document and bring with you to give to your instructor. Lastly, there is an evaluation of the clinical instructor and clinical site. Students can complete these once the course is completed, and I will review them. Again, for all of your assignments, be sure to review the grading rubric attached to the assignment. Review these to ensure you're completing all components of an assignment to earn maximum points. Just a reminder, the clinical schedule is found here under the modules tab, and there is also a document here listing all the assignment due dates. And lastly, in your Eagle course shell, there is a calendar and all your assignment due dates are listed on that calendar, as you can see. So enjoy your clinical rotation. As always, if you have any questions, don't hesitate to ask me. I'm here to support you, and I'm really excited to be your faculty for this portion, and I look forward to working with you. Thanks.